We're now moving on to the Chair's report. I take it everybody has read the report, but there's just one or two items I wanted to highlight. The first one is the appointment of Adam as Chief Executive Officer over the 8 CCGs. This is your first governing body meeting for Coastal West Sussex in that role, so congratulations. It's nice to know that we're going to be having you as part of the governing body into the future, so thank you very much and well done. The next item was around listening to the public, and within my report there is a summary of the outcome of the big health and care conversation roadshows that happened in the last few months of 2018. That is available on the website for the public if they want to go on and read the report, which I think is really, really helpful. And the outcomes of that are actually feeding into our business plan, which you'll see later on in the agenda. So I think I just want to mark that what a really good piece of work that was and how helpful that has been to the CCG in its planning. I think that's all I've got, unless anyone's got any questions for me. Okay, thank you. Adam, over to you, Council Officer's report.
Thank you. So I'm assuming it's read, so I'll really pick up the highlights and take any questions as you may have them. So yes, thank you for the very kind messages I've received over the last couple of weeks regarding take on the substantive chief executive role. Lots for us to do really, but I think we're at a good point for building from the work we've done over the last year in Coastal West Sussex to really take that forward as a collective group going forward. So I'm pleased to be able to help drive that through with you as a governing body. Welcome back, Sue. I think it's really important to recognise that. I think for the government to be aware, we've agreed a really, I think, a clear handover process between Sue and Jill over the next quarter, and we'll be giving you an update as to how that looks towards the end of March, but how we do the handover formally at that current piece. But I think all is looking good, and we're getting things into a neat place for that handover for the end of Q4. And I'd like to personally thank Jill for continuing to take this forward for us for the next quarter to help us land in a good position at the end of the financial year. How are we doing? So a few things to update you on first of all. At times we sometimes get announcements that come through the press rather than directly to us, and one was about the management reduction to CCGs that we received just prior to Christmas. So I received a letter from NHS England that informed me of the requirement that we would need to reduce our running costs as a CCG by 20%. That is the overarching budget that it costs to run the organisation going forward. We thought it was important to inform all staff at that point because it was in the public domain, so I sent out an all-staff communications to all 8 CCGs about that going forward. What that means, it still feels a little bit unclear in the operating planning guidance that we've received for this year, what that actually means, because the letter sort of made it feel like it had to all be removed in 1 year. The operating planning guidance is a little bit less clear on that, if that's fair, Pippa, if that makes sense. So we're still working that out as a collective group of CCGs. However, having spoken to all of the chairs of the CCGs, we are really clear that we are aiming to look at areas of non-pay initially for reducing the running cost of the organisations going forward, and that requires us to look at everything, our estate, our IT, all those areas, to see what are the areas we can focus on first, rather than going to a significant management restructure going forward. We will need to consider that at a point in time, but we're trying to consider those options going forward. And we're aiming to take back a position on that towards the end of March to all governing bodies about how I plan to approach the 20% reduction, and we'll take that through with a seminar before that meeting, so you can therefore be part of the decision-making process that we're taking for that. The financial position, I won't steal Pippa's thunder because Coastal's going well, isn't it, really? We're pleased as to where we land financially, albeit there's still a few things to lock down for a safe landing at the end of Q4. Is that fair? But we feel the turbulence has gone at this current point. Is that fair? Brilliant. STP. At our last governing body, we discussed what was the clinical case for change. There was quite a lot of feedback about that at that current point. So I took that feedback back to Dr. Manesh Patel, who chairs the Clinical and Professional Cabinet, about the concerns. Within the governing body, there were concerns about describing the role of primary care and how primary care is feeling and also reflecting the pressure it's under in that current piece and in the document that we had. What we're now aiming to do is to work through a bridging document that takes from the very big case for change into the key strategic things that we think we need to focus on across our STP area. And we've been really, really clear that primary care needs to have its own clear focus for that. So I hope that assures you that we've taken back those comments and fed that back to the STP going forward. Governance review. We are publishing on the website our governance review in line with good practice going forward too. That will be aligned, and Terry is currently working through with the team and Musa about how we respond to all the recommendations of that. I think part of what we're doing today is demonstrating that we've responded to a lot of it, but there's still some work to do to get that in the right shape. Local matters really. Winter it has been a challenge across the wider Sussex and East Surrey system, but locally it's going quite well. We're not without pressure, but currently things are holding up in a good position. So I do support the view that the winter plan is in a good shape. However, I think it's the type of thing you've got to keep a regular daily and weekly review about. Is it targeting the right thing going forward? But the team have got, in my view, a good position. Dementia. So it was the test, wasn't it, when I took on the interim role with you all, could we hit the dementia target within a year? And the unvalidated data would indicate that we've done that, which is a huge thing for us to have demonstrated for our population. But also it shows, I think, a good working relationship between the CCG and our member practices about how we manage that going forward. So we really need to make sure that the team are congratulated for that, so I'm really pleased we've got there. We're still recalibrating the data, so thank you, Alex, for your comments earlier, just making sure that we're clear about the actual predicted prevalence of dementia in our population for the next 10 years, to make sure that we're clear. The 13,000 figure we built on older data, and we're able just to check, is it relevant and current now going forward, so we make sure we've got the right planning going forward. Stroke. It was asked from the governing body that I'd always mention stroke in my report to the governing body rather than have loads of papers on it every time. I know the Finance and Performance Committee had a good discussion regarding stroke at the last meeting last week, and I think we're feeling confident that if we can get our early supported discharge team in place from the beginning of 2019-20, it therefore creates the environment where we can then start saying we've got the community assets in place to therefore start to make the changes we need to in that area going forward, and we'll continue to update the governing body on that through the joint stroke delivery group on an ongoing basis. And the two positive pieces of news really, one about Brighton and Sussex University Hospitals Trust. So whilst we don't see a significant amount of activity from coastal to BSUH, we do see some, particularly with the specialised services. I think it's really, really encouraging that they've had their special measures lifted and they've been rated good through the CQC. That's a significant improvement for the organisation. Obviously also for us, the Chief Executive of our local trust also runs that organisation too, and you'll be aware that I think it's that Marianne Griffiths has been awarded a damehood in the New Year's Honours at the beginning of the current year. I think that's an important thing for us all to celebrate and recognise that we've got a leader within our system that has been recognised nationally for the work they've done thus far. That's really the main part of my report really. I'm very happy to take any questions.
Questions from Joe?
Sorry, really quick one. About the early supported discharge service around stroke.
Yeah.
Just, is it, it may have been discussed at the FNP, so sorry, but the liaison with primary care, and is that being looked at? We haven't yet communicated that to our members as far as I know. Have we had it?
Or Sarah, actually?
So, I mean, we're in early stages in really working with our providers to actually look at what that might look like and how that might be provided. So we're not at the stage for it to be coming out to primary care at the moment. Of course, we will involve primary care.
Because it's from April. So
yeah, I think to be fair, there'll be more substantial plans in place.
Okay.
I don't think that it will be rolling out at the beginning of the new financial year.
Thank you.
Alex?
I just had some slight concerns on stroke about what NHS England are expecting of this body and by when. As I have it in my mind, one of the key things they're wanting is a clear HASU and for our population. And this work underneath that is to support Western in their decision making around that. I think I just wanted whether there's a potential for our plans in working with Western to be, take too long timescale-wise what NHS England is requiring of us in terms of it.
I think we're fairly aligned with NHS England in understanding what our time frame is and having to fit in with, for example, the 3Ts project in Brighton.
Yeah.
I think that what we are really pushing to do is to commission for outcomes. So we are working with the providers to say this is what we want to achieve, meet all the national standards within a given time frame, and how do we then do that. So that's and our partners are working with us very closely on that. And there is agreement and understanding.
If I can just add, what we are also, we are absolutely aligned to the national NHS England outcomes framework for stroke. We're expecting an update on that, I think, later this month, I understand, about the revised plan. That's going to, I understand, be even more prescriptive about the benefits of having a HAZU and how stroke services should be aligned. That's helpful, because that is what we are commissioning to. Irrespective almost of what the providers say, we are commissioning to that outcomes framework, and there needs to be a darn good reason put forward if we are not going to be commissioning to those standards. So I think that's helpful.
Malcolm?
I think one of the things that came out of the discussion at F&P last week was the benefit of perhaps a slightly more detailed project plan, so we can see that we're making progress along the journey to the end point, really, that we've got at the moment. We know where we want to get to, but our ability to monitor and understand whether we're making progress. So I think we had a useful discussion about a more detailed project plan, which may actually bring some of those issues into it, so we can judge when we need to do things and whether we've achieved them. So I think that was a useful discussion. So.
I think to support the team working locally, it's a complicated piece, as you all know from your history doing it. But the other part also is I think what Sarah's drawn out is the issue of, we've also asked for the modelling to be done again, and that's also been asked for by NHS England. The reason being is, if you imagine, a number of our systems have done their stroke sort of reconfiguration piece, and this is the part of our STB that hasn't. But unfortunately, we've got to be really careful about flows when it comes to Princess Royal Hospital and the county site for BSUH. And we just want to make sure that the modelling done in the 3Ts changes doesn't create a problem by, if we were to move our HAZU, then actually we've got a gap in service. So I think what's happened with that, initially there was some pressure about why are you behind Coast in getting this done. There was a definite pressure that we received that. I think that has now moved to, we still want to see us get done, do it correctly. However, we recognise the interdependencies much more than before. Is that fair, Sarah?
Yeah, I think we certainly recognise them, but I think it's just bringing it much more onto the table and having it in a proper discussion. I mean, we have to remember we do have very highly performing stroke units. We are, our SNAP data is very good. What we don't provide is 7-day consultant review and 7-day consultant cover, and that's how do we achieve that is one of our key drivers.
Okay, thank you. I think that was a really helpful discussion, and that will come back in your next report as an update, so that will be really good for us to understand where we're going.